Good day, my name is Frank Louis R. Patigas from BSN 3B and I'm going to demonstrate the abdominal assessment.
For the preparation, assemble equipment and supplies. The equipments needed are ruler with centimeter, marking pen, stethoscope with bell and diaphragm, alcohol swab to clean ear and end pieces. For the procedure, introduce self, identify the patient by asking name and date of birth, explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Wash hands and observe other appropriate infection control procedures and provide for client privacy.
Sir, I'm Frank Louis Patigas, student nurse sa NUNESCOS and ma-assess.
Abdominal Assessment.
Pwede mo ma-state yung name, sir.
Ako si Arn Lopez, 22 years old.
Determine client's history of the following: family history of abdominal pain, abdominal distension, and other abdominal problems. Last visit to doctor for abdominal problem and current symptoms of abdominal problem.
Sir, sa mga i-consulting na kay mga abnormalities or mga complications.
Wala, sir.
For the inspection, inspect the abdomen for skin integrity, inspect the abdomen for contour and symmetry, observe abdominal contour while standing at the client's side when the client is in supine position.
Sir, pwede ka ginawa dalom, sir?
Assess the symmetry of contour while standing at the foot of the bed. If distension is present, measure the abdominal girth at the level of the umbilicus. Observe abdominal movements associated with respiration, peristalsis, and aortic pulsations, and observe for vascular patterns. For the auscultation, place the warm diaphragm of the stethoscope on each quadrant. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Auscultate the abdomen for bowel sound and vascular sound. Listen for active bowel sounds every 5 to 20 seconds. Percuss 4 quadrants and starting from the right lower quadrant proceeding to the left lower quadrant. Percuss the liver to determine its size at the mid-clavicular line or 4 to 8 cm at the mid-sternal line. Perform light palpation first for tenderness or muscle guarding. Light palpation. Hold the palm of your hand parallel to the abdomen. Depress the abdomen wall about 1 cm in depth. Move the finger pads in slightly circular motion. Note any tenderness, ask the client to tell you about them, and look for patient facial expression. Perform deep palpation over all 4 quadrants. Press the distal half of the palmar surface of fingers of one hand into abdominal wall. Depress the abdominal wall about 4 to 5 cm. Normally, tenderness may be present near the xiphoid process over cecum and over sigmoid colon. Check for rebound tenderness at the areas of pain, which indicates peritoneal inflammation. Palpation of the liver. Palpate the liver to detect enlargement and tenderness. Stand at client's right side. Place your left hand under client's back at the 11th and 12th rib. Place your right hand parallel to the rectus muscle with fingers pointing toward the rib cage. Ask the client to breathe deeply and press upward with your right fingers with each inhalation. Maintain your hand position and ask the client to inhale deeply while the client inhales. Feel the liver border move against your hand. During exhalation, palpate with a depth of 4 to 5 cm.
dalong sir.
Palpation of the spleen. Stand at client's right side. Reach across client to place your left hand under client's posterior lower ribs and push up. Place your right hand below rib margin. Ask client to breathe deeply and press hands together to palpate spleen on inhalation.
Ginawa dalong sir.
Next is the palpation of the kidney. Place one of your hands behind lower edge of rib cage and above iliac crest. Place the other hand over corresponding anterior surface. Instruct client to breathe deeply. Lift up lower hand and push in with upper hand as client exhales. Repeat on other side.
Ginawa dalong sir.
Palpation of the bladder. Palpate the area above symphysis pubis if the client has a history of urinary retention. Normally, no palpable.
Ginawa dalong sir. Ginawa dalong sir.
Thank the patient for cooperating.
Thank you sir for the cooperation of this assessment.
Do aftercare to the patient if unable to help self, or ask patient to do aftercare. If able, ensure patient is in a comfortable position. Do hand hygiene. Document findings to the patient's record.